So before you can start staining a bacterial cell, the first thing you have to do is to fix it. With the fixation process, essentially what you want to do is you want to preserve the integrity of your bacterial cells, but you want to kill the organisms at the same time. So really the best way to do this are using either two of the following techniques: heat fixation or methanol fixation. Um, and so with heat fixation, sometimes this can lead to distortion of the bacterial cell's morphology. So some researchers don't employ this technique, but for the most part, it still works very well, especially if you're just doing something simple like gram staining. So when you do a bacterial smear, all you do is you add a drop of water to a microscope slide, and then you mix in your bacteria. And then you let that dry for about 30 to 40 minutes until it's completely dry. The next step for heat fixation is to pass that microscope slide over a flame to heat fix it. So you don't heat fix the side of the microscope slide where you've applied your bacteria, you heat fix it on the bottom of the slide. And this will cause the bacterial cells to adhere themselves to the slide. Fixing them in position for staining. With methanol fixation, all you simply do is put your sample put a drop of water on a microscope slide, add your bacterial sample, let that dry, and then you take the slide and you place that in some methanol to allow it to fix for a certain time period. So those are the two techniques that you would use to produce your bacterial smears. And here's an image of that taking place. I'm not going to show you the video of it. It's very, very simple to understand. Here's your microscope slide. This is what we call an inoculation loop, okay? And then that inoculation loop spreads the bacteria inside of a drop of water that's been added to the top of this slide. You allow that to dry, and then you can add methanol onto the air-dried smear that you've created. If you don't add the methanol, then what you do is, like I said before, once this is dry, you just pass it over a Bunsen burner flame 3 times. So 1, 2, 3, and you heat on the side which is below where the smear has been applied. So once that's happened, now you can employ the rest of the staining process depending on what your staining technique is. So if we were doing gram stain or simple stain, you simply add crystal violet or methylene blue to the slide, and then you let that sit for about a minute. So time it for 60 seconds and then wash it off with water, and you can blot dry. And then we look at bacteria underneath the microscope, and to do that we use our highest objective lens, which is our 100x objective lens, also known as the oil immersion lens. So it's not rocket science on how to do this. It's a very simple and easy technique on how to do the smear preparation. For the gram stain process, there's a number of chemical reagents that are involved. There's crystal violet, which I've talked about before, Gram's iodine, decolorizer, and then safranin, which is known as a counter stain. So remember, as I said when we started this unit, we have bacteria that are comprised of 2 major groups, gram-positive and gram-negative. Gram-positive bacteria, they have thick layers of peptidoglycan, and they stain purple under the microscope. For gram-negative bacteria, these guys have 0 to 1 layer of peptidoglycan, and they stain red because they take up safranin when we stain them using the process of gram stain. So whether or not a bacteria is going to be positive or negative is all dependent on whether or not there is a high content of peptidoglycan integrated in the cell wall of the bacteria. And we're interested in this, remember, because the thicker the peptidoglycan, the more the better chance we have at killing a bacteria using a specific antibiotic, much the same as penicillin. So penicillin is great for killing gram-positive bacteria because it will target thick layers of peptidoglycan and break up that peptidoglycan, and it causes the cell to break down. Gram-negative bacteria, we can't do that. So the key thing that we want to know from a gram stain when we do that is whether or not a bacteria is gram-negative or gram-positive. And that will determine what our treatment regime is for somebody who's infected with either a gram-negative or gram-positive bacteria. So gram-positive bacteria will stain purple under the microscope, and then gram-negative bacteria are going to appear red when we view them under the microscope because of the stains that are taken out by them. And here's an outline of the process that's used to do the gram stain technique. So after heat fixing your slide, you add crystal violet, like I said before. You let that sit for 1 minute, and then after that you wash it off with water. The next step is to add iodine to the slide, and that iodine then will react with the crystal violet, and it will cause the crystal violet to be taken up by thick layers of peptidoglycan and gram-positive bacteria. So you let the iodine sit on your smear for 1 minute, and then you wash it off with water. And then the next step is to add a decolorizer, and what the decolorizer does is it will remove any crystal violet from the slide that has been applied to gram-negative bacteria. And so once you add the decolorizer, you don't do this any more than 30 seconds. Your book says 5 seconds, but that would be too little. So 30 seconds is typically the rule of thumb here. So you wash off the decolorizer after 30 seconds, and then you add your counter stain, which is going to be safranin. And in this procedure from this book, it says do it for 30 seconds. I always do it for 1 minute, and it comes out fine. Because your safranin is lighter than your crystal violet. So when you apply this to your slide, all your cells that are typically purple, they're not going to be stained red because they have the iodine helping to adhere them to the gram-positive bacterial cells. So you can add safranin for 1 minute and let that stain, and safranin will color all of the gram-negative bacteria on your slide. And then you'll wash all that stain residue off, and then you'll blot dry and view it in a microscope, which will allow you to determine whether or not you have gram-negative and gram-positive bacteria. And in some instances, you can see both red and purple, but so then you have to look at the cell shape and cell arrangements to determine if your bacteria are different. So that's gram staining pretty much in a nutshell. So differences between gram-positive and gram-negative, which I feel like I've already highlighted. Gram-positive, again, are going to be purple underneath the microscope. Some people call it blue, but it kind of depends on how your eyes are. So blue to purple, as your book kind of refers to them as. I just always use purple. And then pink to red for gram-negative bacteria. I always just use red, but for some people, they consider the gram-negative stain to be pink. When you see purple under the microscope, you should immediately know that your bacterial cells have a thick layer of peptidoglycan. If you see red, then you know they have a thin layer of peptidoglycan. With gram-positive bacteria, you have the presence of certain acids that exist in the cell walls. You have tiocholic acid and lipotiocholic acid. We don't really stain for these, but we just know that those are present based on experiments that have been done evaluating gram-positive and gram-negative bacteria. Gram-negative bacteria lack all of these acid components in their cell walls, so you don't have to worry about them having that. And then LPS, remember I told you that lipid polysaccharide, or lipid A, we only see that present in gram-negative cells. We don't see that present in gram-positive cells. So those are the key differences that we have between gram-positive and gram-negative bacteria. So sometimes you see some different variations in gram-positive bacteria. Typically, gram-positive bacteria you find mostly in organisms that have a bacillus shape to them, and then there are some other differences, like Staphylococcus aureus, Staphylococcus epidermidis. But typically a lot of the coccus bacteria are all going to be considered gram-positive. So you have kind of a nice hodgepodge between positive coccus and positive bacillus bacteria. Gram-negative bacteria, typically we are looking at gram-negative rods, but then there are some gram-negative coccus-shaped bacteria. But these images are just some selected streptococci that you can see here, and here's some Streptococcus pneumoniae. That's taken from a blood culture. These are some gram-negative, or sorry, gram-positive. I saw that hyphen there, thinking negative, but these are gram-positive bacteria. Gram-positive bacteria. These are all bacillus in shape. We have bacillus organism called Clostridium perfringens, which is kind of an organism that can elicit some toxins or endotoxins with it, kind of like Clostridium botulinum, Clostridium tetani, which can cause tetanus in some patients, which leads to lockjaw. All of these, if you look at them underneath the microscope, they kind of appear at different kind of shapes. This one, Clostridium tetani, is pretty interesting because if you look here, you can actually see a spore form at the end of one of these cells. So you see that little club-like shape at the end. That's actually a spore that's starting to be generated by the Clostridium tetani organism. So that's pretty interesting. And then this Clostridium perfringens, we don't see any endospores being present or any spores being generated. We just see the shape of the bacterial cells, which is bacillus in nature. Here's some bacteria that are surrounding some epithelial cells. So if you took like a culture or cheek swab from your mouth, you may see some gram-positive bacteria after staining your cheek cells surrounding your epithelial cells. This pink spot right here, that's the nucleus of the epithelial cell, and then this lighter pink region, that's going to be basically the cytoplasm and the rest of the cell, and everything stained purple is your gram-positive bacteria. It's a very interesting thing to see. Here's some gram-negative bacteria images. In this particular image, you see we've got very small gram-negative rods. If you were looking at them under a microscope, you might even consider calling these cocobacillus because they're so short in nature, but they're gram-negative. And then here we have some Borrelia burgdorferi, which, as I said earlier, is the organism that causes Lyme disease. I used to spend a lot of time culturing this organism in the laboratory for research purposes. But you can see the twisting nature or twisting cell morphology that are expressive of this particular organism, which is why it's referred to as a spirillum bacteria. So very, very interesting, I think, to see all of these particular images. A lot more interesting if we had a laboratory component, but unfortunately we don't have a laboratory component to this course. Okay. So let's talk a little bit more about another type of staining technique. So we've already talked about gram stain, but there's some bacteria that aren't able to be gram stained because of the composition of their cell walls or lack thereof. So now we're going to be talking about that group called the Mycobacterium genre. And the Mycobacterium, they have to undergo a process called acid-fast stain in order for us to observe them. And so we use a chemical reagent called carbofusin for this, which is a red stain that's basically going to be push through the bacterial cell wall. And essentially what you do is you apply a little bit of heat that will allow the waxes in the cell wall to kind of liquefy a little bit. And then that will enable the carbofusin to fuse into the cell wall. So the mycobacteria that we use in this process to get stained, they don't get decolorized through using an acid alcohol mixture. And because of that, because we can't decolorize them, we refer to them as being acid fast. And here's an image of what that would look like. So these are acid fast bacteria, mycobacteria, that have invaded some liver cells, and all that bacteria are basically stained here with this red residue that surrounds them. So that's what your bacterial cells are. Here's some more mycobacterium that has been collected from the sputum of a patient, and where you see these red cells in here all of those are basically the acid fast